So how's Vedant doing now?
Mommy's doing very well, touch wood. After the procedure, everything's fine. We're brushing 3 times a day. We are tongue cleaning every time we brush. That was something which was definitely very new for me. I didn't know, children are supposed to also tongue clean, and that's another revelation that came with the first meeting with you. So things, oral hygiene, if we were notches below us, is now at least hopefully at the desired level. That
Yeah, I remember I telling you you've turned 360 degrees
yes.
the other way. So do you remember how when you came in the beginning?
Absolutely, ma'am. I remember pretty much everything from the day we came in. So I think the origins of coming here was because he was having some teeth issues and teeth pains, and we have friends who are his school friends. Parents are doctors, dentists actually. So I went to them and asked them that where should I take him, and my friend referred me to you. She said, if I have any issues with her child, she takes it out to Dr. Aruna. So I was like, wonderful. If that's the vote of confidence you have as a dentist, then I'm very happy to go. And it so happens that I'm relatively new in Chennai still, but Capstone is a name which rings familiarity with a lot of local people around. I had also been to Capstone for my wife's procedure de facto 3 months into when we were in Chennai. And that was because one of my colleagues referred me saying, if you want to go for any small procedure, she had a toenail removal. So she said that he told me that just go to Capstone. They're very good. Doctors are very good. And they had a very nice experience. So when Priyanka told me to, come back here, and I was like, there's no dental practice here because we come to the first floor and this procedure mini OT is there right next door. So I was like, where is the dental setup? And then I realized that it's on the second floor. And I still remember very clearly of what happened as we came in. You were very nice and warm by welcoming us with a smile, which is such a nice thing to have as soon as you step into the doctor's cabin. The room was very child friendly. There were lots of posters of cartoon characters, so I think the child could.
Yeah, Avengers.
Yeah, Avengers is there now, sir. Yes, we have still not got to a point where we've introduced the cartoon characters, but the idea was that he felt very quickly. If I were a child of that age, I would have felt the comfort. So I think surroundings also put you at ease in a very quick fashion. So that was very helpful. And I still remember very clearly that, you asked him to get onto the chair, but he was a little nervous and skeptical. So you allowed his mother to sit on the chair and then you allowed him to sit on. So I think some of the basic things that you established in terms of, even the short 1-2 minute introductory conversation, which was not anything to do with dentistry, but just to say hi, hello, where are you from, etc. It just set the comfort. So thank you so much for that. You were very kind, and all of that really set the context of allowing the trust. The exchange of trust, because in your profession the most important
Correct.
thing is.
Correct. And I remember with him we had so much decay. So
Yes.
it was a little bit of a difficult conversation,
Yes,
which I think you all took some time to digest because
absolutely.
it was not something as simple as just coming and sitting in the chair. And so, of course, a very young child.
Yes.
So sitting in the chair and getting some dentistry done, it did involve bigger things like general anesthesia. Where we went through the whole procedure. And I remember kind of breaking it to you all the while thinking that this is going to be quite difficult for you to digest because when you come into a doctor's office, you don't expect to go out saying, oh, dearie, now there's like so much. So what were your thoughts, during that? Because I know I have that conversation with a lot of people every day. But what were your thoughts or what did you gain from that? Or, what was it that kind of set the tone for you to come back and say, no, you know what, I know he's in pain. Let's get this over with, and then we have to do the entire procedure. What was that thought process?
So, doctor, I think and I think it's very subconscious and intuitive, but at least as a patient, when you walk into a doctor's cabin, I think it's a very binary call. Do you trust the doctor or do you not trust the doctor? And without knowing, you made that decision irrespective. And that comes across when you see the doctor's empathy, the doctor's genuine care, concern for the child, which I felt very, I could relate to how you had a lot of empathy when you saw the child, and that was very natural and genuine. And the kind of advice that you suggested, or the course of action that you laid out, I wouldn't know whether that was the best course of action or what it is, but for me, the question was, it's a very binary decision. Do I trust what this doctor is saying? Do I feel that sense of comfort? And we got that very instantly. So then the other aspect of whether this is the best course is just maybe, getting a second opinion, or just checking with another doctor friend that, look, this is the case history. This is what the doctor suggested. Do you think it's the right sort of course? So it was pretty much that. So I think the kind of efforts you put into establishing the rapport, into establishing the trust, which came very genuinely from your side, was what helped me sort of. Was the thing that really helped my wife and me to take.
That's really nice to hear, because see, as doctors, we have these conversations every day.
Right.
But it's very rare for us to get feedback that we actually got through to you, because a lot of people, some of it may go over their head, some of it they'll say, no, whatever you say, let me check around or whatever it is. And I encourage questions, I encourage second opinions, because I'm very confident of what I'm saying, right? So that's very gratifying to hear that you actually, that conversation actually worked for you, which means it worked for a lot of others as well.
I'm sure it did. And I think, Doctor, one of the other things at Capstone, which I've noticed, and these are again very soft elements, but very useful elements, is that I remember very clearly after you suggested that, the procedure and the framework, I had a follow-up or 2 or 3, right? Because I came in with the intent that he has teeth pain, and I went out with the intent that he has to do a, detailed procedure. So during that time frame, I remember even conversing with Raji madam here quite a few times. She was very kind to tell me, okay, these are your 3 questions. Wait, you don't need to come in all the way, from a location. I'll just patch the doctor on call and then patch you in. So, just some of those finer aspects of the support staff also, adding to the experience of what a patient went through, just providing that incremental convenience. I mean, if she would have told me you need to come and speak, I would have been happy to do that. But as I reflect back, she gave me the convenience that you don't really need to come here. It's just 3 questions. I can get it solved over the phone. These kind of softer elements also are very useful. And every time I've called Raji madam or the support staff for a follow-up or for some query, they've been very responsive and nice in sort of explaining, or even probably doing it 2 times over. So I think all of that really adds to the comfort and experience with Capstone.
So what has changed for you? So we went ahead and we did this huge procedure. We sorted his teeth out. I remember telling you that there is some compromise. I was a little concerned about the way some of the teeth were. And then I went back to telling you about, regular brushing, making sure it's done twice a day. Of course, I realize you're doing it much more than is needed, but you said I told you all of that.
Right.
So how did Vedu take to it? I mean, how did he, did he, from a child's perspective, now this is, I know from the parent perspective, you realized I have to do a whole lot more. But what was the difference you found with him? Because I know he came to me in pain, and my only objective at that point in time was I have to rid the pain, because that's what we are there for, right? So all of the extra things that you are talking about are things that we just do every day. That's what we just do, right? But how is it for Vedu? Has he ever, told you something about, I like to go to that place, or, I feel so much better, or I can eat chapati without pain, whatever, I don't know. Is there anything like that he would have expressed to you?
So, ma'am, I think there are 2 parts to this. And if I were to break it up into the precursor that you set us up with, which I think was very useful, and just to highlight a couple of things. One is, and I remember these words very carefully that you had sort of pointed out, is you didn't want the child to go through future trauma, because the child was going through a procedure at a very young age of 3 years. That's already traumatic for him. So you wanted to ensure that he does not face any trauma, so that in the future, as he grows up, there should be good memories for him to go to a doctor and not a traumatic experience where he does not, or he finds it resentful to go to a doctor.
Correct. Which is the reason also we suggested anesthesia, because of the amount of work, the extent of work that was done.
So I think just that general preparation, and also prior to the procedure, you were very clear, or rather just after it, you told us that make sure it's a very normal experience at home, because, I remember clearly the conversation was that if you ask the child multiple times, is it paining you? It becomes like a self-fulfilling prophecy where if he says yes and gets that assurance, then the parent circle is there. So we had to keep it very normal and basic, and our conduct of how we're supposed to be post-surgery, what kind of care we're supposed to take. I think all the setup that you had educated us on was just implemented. So what that did is that the post-surgery experience was very normal. He got back. In fact, the next day he was back to school. Yes. And there was absolutely no concern, no challenge, nothing of that sort. And life has gone on since then. And, I think the other thing is, for whatever duration I remember he's been with you, it's been comfortable for him, because as an output, as we look at it, we're brushing 3 times a day. We're tongue cleaning every time. We're checking, just ensuring. Which I didn't do as much. And one of the biggest revelations for me was that even children need to do a regular tongue clean. I had never done that with the 3-year-old. So just setting some of those right practices that need to be done so that, it helps in the long run was what you educated us. It was very nice of you to do that. And I think it was just putting it into action and implementing them, which is what we've been doing. And I think the follow-up, consultation that we had with you, he was pretty cool about it. So that I mean, he's a 3-year-old, so he can't really express as much.
And I don't think he sat on mom's lap
the second time that he
came and practiced
yes, absolutely.
Because that's the beauty of taking away any kind of, threatening things.
Absolutely.
You just want them to be comfortable. If they're able to sit in the chair, that's the biggest war.
Absolutely.
For me as a pediatric dentist, if I can get a child to sit down and just let me look, I've won half the battle. That's how it is.
I remember you asked him to open his mouth and he gladly did that. So I think that again happened because of your nature, your involvement with the child. And I find it I find your sense of empathy towards the child very high, which is, I think, a skill that...
I've done pediatric dentistry for so long, it's become part and parcel of me. I've always been an empathetic person. This has just enhanced it because I've always cared, whether it's animals or whether it's humans. For me, I love all of them. I love animals as well. So It comes to me for anything, for any kind of a situation that requires empathy. I think it's something so human. I think you need to be that too, right? For me, especially because of the work that I do. In pediatric dentistry, I don't think it's possible for us to just say, sit, open your mouth. That becomes very difficult. In fact, I should share a story with you about a patient of mine who I've been doing braces on. And she landed up in Salem, her native town, and had some wire poking, her. So she goes into the dentist's office and she gets up and walks out. And mom did not know what was happening. So she said, you said it's poking. I brought you all the way here. Now you're saying, no, I want to go back to Chennai. She came all the way. She waited. She put, I remember she used chewing gum and kind of plugged that little wire. Came all the way back and she told me, she says, you know what? I need to go to a dentist who can talk. Because the dentist sat me down and said, open your mouth.
Yeah.
I said, no, I'm not going to. These are children.
Yes,
So
absolutely.
you have to be at their level, which is why I watch all the possible Avenger movies and everything else. So, most of the times I know what they're seeing. And we have discussions. In fact, I have kids who give me movie lists.
Wow.
You should see this, auntie. You'll really enjoy this. My parents, they don't come. But you enjoy it, which is so nice because we're already at that level. But that's how it's been. That's how I think you should be when you're treating a child, whether you're a pediatric dentist or a pediatrician. I think if you're treating children, that comes with...
No, but actually, that's what distinguishes you or Capstone as a clinic, the kind of empathy you have. And, you with children, especially you transform and you deal with them in a certain way, which is what has helped you get so many, so many children.
Probably, but every day I get one parent who says, can you see me too? No,
If that
I don't think I would be a great adult dentist, seriously,
I beg
because
to
I wouldn't
differ.
know what to say to you, With children, I can talk, they can, they listen, they'll stop me mid-procedure, all of that, but not with an adult.
I beg
I
to
would be
differ.
worried about
No,
adults.
I beg to differ. I think you would do wonderfully well, and if the option is there where you're treating adults, I would be the first one to be.
Not in this lifetime.
But no, I think so. That's there. So a lot of credit to you, to the entire clinic. I think the approach is very differentiated, and I think it's very relatable for a child, which is the most important thing. And I think the kind of advice you have given is always very spot on and genuine. At least I feel that very, very closely, because I don't understand technically the advice you would give me, and because it's not my profession. But what
Yeah,
rings
because see, the belief for me is when there is a problem, I have to find the source.
right.
So I remember telling you, about how this brushing, tongue cleaning thing came about is I need to find why this child is having decay. The easiest thing to do is to say, you know what, you got to come in tomorrow, you get your procedure done, and that's it.
That's it.
That is one way of looking at it. But for me, personally, I've always, with every child, tried to figure out why are they getting it?
Correct.
Where is the source? Is it sugar? Is it not brushing? Is it whatever it is? Because if we attack the source, then I can prevent this from happening for a very long time. Obviously, as they grow into adulthood, neither you or I can prevent anything from happening. But at least till they go through my age group, which is, at least till the age of 15, I've got all their teeth in this lovely smile. I'm done.
Yeah.
Beyond that, obviously, it's up to them. But I think trying to correct that source, which I find is lacking, is very important.
I fully agree, doctor. I think you, even in our conversations, you got to his dietary habits, which led to the discovery of the process that he was consuming a lot of, sweet items, which were, staying in the mouth, which was causing the decay. I think your approach has always been to get to the crux of the problem, which was very useful and we've actually made dietary changes so that we can adapt to, a new regimen for.
That's great. That's great. I applaud you.
No.
Because it is a tough thing. With a child, there is a routine that's already established, So when I tell you brush the child's teeth before the child goes to sleep, sometimes people eat quite late. The child also eats quite late.
Right.
So it means shifting your time, shifting the child's time to make sure that they eat early. There are some children who will throw up if you start brushing right after.
Oh, okay.
So I have that group also where I say no. So let's try to, up that time to say maybe 7:30 at night or 8 at night that you finish dinner. You give them an hour's worth of playtime or whatever it is, and then make sure that you brush. And that has also worked, with a lot of people, just like...
No, that's very true, doctor.
Yeah.
And
what do you think about this? I know I've called you back for a regular checkup with Vedant, just to see, not right after the general anesthetic procedure, but after that also.
Yeah.
So what is your opinion on that? Do you really think, because I feel as a dentist, I feel that regular checkups are very, very important. But along the way, I find that people get complacent. So once we finish the procedure, you're all fine. Why would you want to come and see me? What is it that would prompt you to say, oh yeah, I have to go for this regular checkup?
right.
They've sent me a message, or somebody called me and said, your 6-month checkup is due. Why would you, what's your opinion on that?
So, doctor, one thing I've realized is that, what regular checkups help you do is very early diagnosis of anything that may be going off, right? So instead of identifying it late, say maybe if I did not do my regular checkup, say in 6 months, and I came, say, after 1.5 years, I've allowed the problem to cascade for a far longer period. So one, regular checkups just help you to maintain sanity and check. It's like, just doing it now can address a specific issue. Why allow it to balloon, right? So that's point number one. Point number two, it gives me a chance to reconnect, which is always so nice, because every time I come here, I learn something new with regards to oral hygiene or in general of how or experiences that you share. That's just very useful in oral care that is required. And I think, doctor, you've only said this, that the less you see of us is better. But so it's that kind of thought that you want, which means that if we do it regularly, it will lead to lower problems.
Yeah, I tell children, don't make me do work. I'm bored doing work. come in, get your cleanings done, and just say bye-bye. And it's, lots of hugs and that's it.
That's it.
That's the way. I think children, nowadays with all of that's going on and they have so many things on their plate, I don't like to add to it. In fact, my regular checkups start at age 1.
Oh, is it? Wow.
Why at age 1 is because I could prevent things like, for example,
Yes.
your son, I could prevent that from starting at all.
Yes, absolutely.
Then move him into childhood or through childhood without having too much done apart from the regular cleanings. I think for me, that's my entire aim, is to try to see them as early as I can, so I can do as much of preventive work rather than, doing a lot more work.
Yeah.
But having said that, there is a huge percentage of people that
Who don't do that. Actually, Doctor, if you'd recollect, my statement to you after the procedure was, I wish I met you earlier in life, right? So the only thing is, I think parents don't know that they're supposed to take their children to a specialist, pediatric doctor or a dentist early. And I think if a lot of parents start to follow that, it will just help them in their own maturity of how they're supposed to deal with the child's teeth. And it's a very critical and important area, right? Because your entire source of consumption is from your mouth.
Absolutely.
So I think parents, given young parents don't know that, and it's really
Very true. Absolutely. Because see, I say parents will not harm a child because they want to. Just that they don't know.
No, the awareness
If they knew, then they're not going to be doing that.
Yeah.
That's what a lot of parents tell me. If you only knew that, we would have,
come to you earlier.
Yeah, come down. So sometimes, parents think that it's very harsh because when you're trying to brush a 1.5-year or a 2-year-old teeth, it's a lot of, they're like, no, they don't allow. It's a safer time. It's a lot of hard work. But I believe that, parental control in that situation is so important because you are in control of the child.
Right.
Most times nowadays, the child's in control of the parent.
True.
And sadly, the parent doesn't realize that because I can tell you my 4-year-olds are some of the best brushers. You have to give the child credit. They understand. Even if they're 2.5, they will understand. When you say brush, they will understand.
Right.
May not do it perfectly, but they will understand. So the earlier I think that we see these things and, I hope to get the word out more and more so that the earlier we see, the more we prevent, then the less the work that I will have.
Absolutely. Absolutely. And less pain the child will have to.
Yes. Exactly. I remember he went through so much pain and you went through so much pain.
Absolutely.
That's where the problem is because the parent is also hurting with the child.
Absolutely.
And then, I have children where they've not slept in 2-3 nights and then you get worried and then all these procedures have to be done. So much I think can be prevented with.
So see your doctor often, see them regularly.
Yeah, I think it's a good way, like you say, to build, for me, very good way to build rapport.
Absolutely.
Because then by the time that child is 10 years old and say I have to do braces or something like that, the child's like, this person is just, she just talks, she just does nothing, she just go buck. It's okay, cool, so we'll do it. So I'm not a threat anymore. I think that is so important because I find that there are a lot of parents who don't bring children in, not because they are scared of the child having any problem, but because they are scared.
Absolutely.
There's a parental fear that passes on. Absolutely. So they're like, no, I don't want this child to go through what I went through. Yeah, forget it.
I think, Doctor, you pointed something which is so spot on because as adults, a lot of us, we would have not done a lot of care of our own teeth when we were young, and that sort of cascaded when you're slightly older. And those fearful memories remain with us, which we pass on to our children.
Correct.
Which is not desired because, it's such an important area that...
Because even if you don't say something to a child, I believe a child feels.
Absolutely.
So they're like, okay, something's wrong here. We don't know what, but let's not go near this person because, And then I find that as the child feels better, I have parents coming in to see the dentist because they haven't seen the dentist in, I don't know.
So long.
In number of years, 20 years or whatever it is. And I have those kind of things happening every day, which is very gratifying because at the end of the day, we've all got to look after our teeth. That's the only thing that will stay with us. So when permanent teeth come in, I always tell children, you don't need to go to the adult dentist other than what you come for, like with me. Go and get it clean. Don't get all this other stuff done. They find it quite funny. So we keep it as our secret. And we're like, okay, you don't need to go. As long as you look after your teeth and keep them clean and keep them brushed, you don't need to go to anything. Which the child grows up with good teeth. I think that is truly a great service.
No, that's very true. And ma'am, I must tell you also, I'm from Bombay, so for me, Chennai was relatively new. I think the pricing at which Capstone offers these services is very, very affordable, very value centric. I mean, for the kind of services, the kind of experience, it's a very good pricing. I think it's very competitive. It's very well priced, and it's great value for money. That was my experience that I had.
No, that's great to know because I've never really gone down that route.
Yes, but I just wanted to add
yeah,
that as well.
thank you.
Because a procedure like this, say in a place like Bombay, would have costed 2x of what it would have costed here. So the pricing is very spot on. So credit to you and the team for managing.
Thank you. Yeah, no, I don't think we're really interested in the money. For us,
Right.
for me at least, the passion is
Is
this,
children and
that I can
Yes,
stay, this child is fine and is eating fine and is going to school fine and enjoying himself. I don't think we need anything else.
Yes, but as a parent, often
I
it's
understand.
there at the back of your mind. So because dental procedures are expensive, so
Yeah.
at the back of the mind for any parent to also feel about how the place is positioned in price, I think it's very affordable and very value focused and value centric. So credit to you and you for that.
Thank you so much. Thanks a lot.